today? I would like for each of you to say a little bit about yourself.
Hi, I'm Mayo Clinic, and I'm available to the general public for free on the internet. My information is divided into categories, making it easy to read and fast to access.
Thank you, Mayo Clinic. Now the FDA.
I'm the FDA product label. I can provide all the information you need about a drug. My knowledge covers indication and usage, dosage and administration, dosage forms and strengths, contraindications, warning and precautions, adverse side
Okay,
effects.
FDA, I'm going to cut you off, but that was interesting. Lexicom.
I contain all of that information as well, and I can also be used on a smartphone or a PDA device.
Very good. Wikipedia.
Yeah, I'm available to the general public too. A lot of people use me, really easily accessible. Even though like I can be edited sometimes by random people, but it's okay, I'm still great.
All right. Redbook.
I am Redbook. I can be accessed online through Micromedics or in hard copy by healthcare professionals. I contain the wholesale prices of drugs and ingredients.
Thank you. PubMed.
Well, I'm a secondary source with access to Medline database, which is a primary source, and I'm great for providing specific case studies and clinical trials, but I can sometimes be frustrating because I don't always give you the full text article.
All right, good to know. Thank you for sharing a little bit about yourselves today. Today the discussion is on CoReg, a drug you all should know a little bit about. And we'll start with our first question. What is the generic name for CoReg?
Cargilol.
Actually, it's pronounced
Carbidolol.
You're both of you are correct. Wikipedia and Lexicon both get a point.
Well, I knew that too. I just wasn't.
Whatever.
Okay, moving on to the next question. What is CoReg used for?
It's used to treat high blood pressure.
I'm looking for something a little bit more specific.
Actually, it's used to treat hypertension and heart failure and left ventricular dysfunction following myocardial infarction in clinically stable patients.
Yes, FDA, that is correct.
Yeah, well, I bet you don't know any of the off-label uses.
Well, actually, that was going to be the next question. Worth 5 points. What, if any, are the off-label uses for CoReg?
I'm gonna have to say there are none.
I'm sorry, Wikipedia, that is incorrect. Would anyone else like to answer the question?
Yes, I would. One off-label use is for angina pectoris. How you like them apples?
That's correct. Lexicon, you're now in the lead with 6 points. Okay. What is the pharmacological category of the drug?
It's a B&A blocker, right?
What do you mean? Could you be a little bit more specific?
It's a beta adrenergic blocking agent.
Basically, it's a beta blocker with alpha blocking activity.
B&A blocker, beta blocker with blocking activity, same difference.
Well, Mayo Clinic and Lexicon get a point. Wikipedia, I'm not so sure. No. Next question. What is the typical adult dosage for CoReg?
That's a tricky question because the dosage depends on what the patient is taking the medication for.
And it also depends on the strength of the medication, the number of doses you take every day, the time allowed between doses, and what medical problem you're using the prescription to treat for.
Yes, that is correct. Lexicon, Mayo Clinic, but what are the typical doses?
Well, to be more specific, patients with heart failure start with 3.125 milligrams twice daily and increase to 6.25, 12.5, and then 25 milligrams twice daily over intervals of at least 2 weeks. Maintain lower doses if the higher doses are not tolerated, and for treatment of left ventricular dysfunction after...
Okay, FDA, I think that's enough information. Thank you, Francie.
I knew that. She just didn't give me a chance to finish what I was saying. And you forgot that it's necessary to reduce dosage if heart rate drops to less than 55 beats per minute.
That is correct, FDA. The question is worth 5 points because you say the typical doses for each indicated use, you will receive 10.
Yes.
Next question. Can CoReg be used in specific populations such as pregnant women and or children?
There are no adequate and well-controlled studies in pregnant women. Also, effectiveness in children younger than 18 years of age has not yet been.
FDA, that is right. Lexicon, I saw you try to buzz in, but FDA was quicker. Maybe next time. Next question. What are some side effects of the drug?
That'd be weight gain, nightmares, and other like sleep disturbances, maybe like sleepwalking. Oh, your leg might fall off.
No.
None of those are correct. I'm sorry. Can anybody answer the correct question correctly?
Yes, common side effects include, but are not limited to, chest pain, discomfort, tightness or heaviness of breath, dizziness, lightheadedness, or fainting, generalized swelling of the feet, ankles, or lower legs, pain, shortness of breath, slow heartbeat, weight gain. Less common side effects can be ankle, knee, or great toe joint pain, anxiety, arm, back or jaw pain, blood in the urine, stools, and fruit-like odor breath.
Okay. Yes, Mayo Clinic, you are correct. Thank you for overwhelming us with the most common and least common side effects. On to the next question. What is the average wholesale price for CoRad? Yes, Redbook.
Did you want the 3.125 milligram, the 6.25 milligram, or the 12.5 milligram dosage?
I would take the first one, 3.125.
Okay. The 100 tablet count for that would be $248.90.
Thank you. I'm glad to see that you were able to buzz in and answer your question. That question worth 5 points, so you're finally on the board. Now, this may be a little bit harder. Is CoRed carvedilol on the $4 prescription list at Walmart?
What? Shop at Hollywell?
All right, well, nobody knows the answer, nobody gets points. And the answer is yes, it is at Walmart for $4. Next question. What are some sound-alike or look-alike drugs?
Carvedilol may be confused with atenolol, captopril, carbidopa, carteolol, and Coreg may be confused with Coregard, Cortef, and Cozar.
That's correct. Next question. Can this drug be crushed or chewed?
Extended release capsules should not be crushed or chewed. Capsules may be opened and sprinkled on applesauce for immediate use.
That's correct. Next question. Is the drug supposed to be taken with or without food?
With food.
May take the food.
Administer with food to minimize the risk of orthostatic hypotension.
You're all correct, but Lexicon, you were very specific. Thank you. Next question. What are the pharmacokinetic properties of CoRad?
I bet you don't know this one, but in the body, the pharmacokinetic properties show many differences between the R and S enantiomers of CoRad.
Thank you, PubMed. I'm glad that you got to answer a question. Name 2 inactive ingredients found in CoRad.
The two inactive ingredients are sucrose and lactose.
Yeah, well, I knew that too, Redbook.
Everybody
So
knew
did
that.
I.
You know what? It doesn't matter what you
Whatever,
think.
I can answer all the questions that you've been answering, plus we have way more information than you could ever even
All
think
right,
of.
we're going to commercial break. Tune in next time for when we have an all-male panel discussing Viagra.